Myself, Dr. Pawan Gupta. I am a senior consultant and unit head at BLK Max Super Specialty Hospital, Delhi. So basically, I'm working since last 2 years in this hospital, and my experience is of 18 years in the pulmonary medicine. So basically, BCG vaccine prevents the development of the disease. It is specifically designed to prevent the tuberculosis in children, and it is very effective in preventing the severe tuberculosis in those children who acquire this infection. And it can be given from the birth onwards. So BCG vaccination is generally recommended for the age group of 1 to 16 years of the age, and it is given even at the birth. And it generally offered to the babies who are more likely to come in the contacts with the persons who are having a tuberculosis. So basically, the BCG vaccination is given in the developing countries like India, unlike in the Western countries like USA or the Europe, where the TB prevalence is very low and it is not in the program. Yeah, BCG vaccine is very effective in preventing the severe tuberculosis if anyone gets infection, but not very good at protecting the adult against the tuberculosis, because the immunity against the tuberculosis with the BCG vaccine, it wanes after around 10 to 15 years of the age. So the once one get the BCG vaccine does not mean that the vaccine makes the person immune for the lifelong to the tuberculosis. So the immunity is for at least 10 to 15 years. But in that also, if anyone has the BCG vaccine, does not mean that even for a 10 to 15 years he is completely immune. He may also acquire this if immunity get down. So one can still get the TB infection or TB disease even if one get vaccinated with the BCG vaccine. So once any children or baby get infected with the tuberculosis, it get negatively impact on their physical and the mental well-being. So growth is retarded mentally and physically. Most significant effect is the loss of the weight and the protein catabolism. So the muscle mass can get reduced and the one even get the cachexia. So in the period when the children's their height increases, they are having a maximum mental growth. When anyone get the tuberculosis infections, their mental and as well as the physical growth, it is stunted very adversely. So as a result, the children may miss their school because of the illness, and even can get these psychological issues because the children many times they get irritable. They may have the aggressiveness to their peer groups or to their family members, and even they can go into the social isolation. So it has been seen that with the tuberculosis, the children they may go into the depressions and they have the over anxiety, and all these issues even impact their academic in their academic programs or like in the school activities. So the TB patient should take their TB medication in a proper way and in a proper doses as advised by their physicians or the doctors. One should add the high protein or the high protein rich diet in their regular meals, and they should undergo the regular follow-up in the OPD visits as prescribed by their physicians. Moreover, to prevent their peer groups or their family members or community from transmission of the TB bacilli to get transferred, they should wear the mask effectively whenever they go outside their home or even in the home if they have the cough or sneezing. And moreover, in their early phase of the disease, when the transmission chances of the tuberculosis is very high. So the TB patients, if they take the adequate precautions with the good balanced diet, and if they wear a proper mask, then they can help in community to help in the eradication of tuberculosis as the vision of Indian government by 2025. And especially the TB patients, they should have a proper regular visits to their doctor and good balanced diet.